The deep scars of trauma are not always visible. I think we can agree on that. Physical ones, physical scars, yes, of course, these scars are very often visible, but emotional, mental, psychological scars, not so much. No matter how well we have hidden our pain patterns, at some point, these scars will no longer be able to stay hidden. And the pain that they hold will show itself in our lives in one way or another. And maybe you've already seen some of it in your own experience, in your own life, in your relationship with yourself, in your relationship with others, maybe in all sorts of unhealthy patterns or experiences like addiction, for example, or destructive behaviors. At that point, that's when many of us will turn to traditional therapy. That point where our pain rises to the surface. We turn to traditional therapy because it can be helpful and it's what we know. But the caveat is, I will say that it's only effective to a certain extent because there's always seemed to be kind of a deeper layer we can't quite reach. And it's not because therapy isn't valuable, because it is, but rather because talk therapy primarily engages the part of the mind we call the conscious mind, not the subconscious mind. Now, the conscious mind is our logical and rational mind. It is our educated mind. It's the part of your mind that is listening to me right now, analyzing, critiquing. It can reason and accept or reject. That is your conscious mind, but it does not deal with emotions. The subconscious mind, on the other hand, is our emotional mind. Think of it as the storehouse of our knowledge and perceptions and beliefs and memories. And since the nature of trauma, for the most part, is emotional, we have to address the trauma where it resides. By that I mean the subconscious mind. Otherwise, any relief that we will experience will be temporary and not an actual resolution. So that's where clinical hypnotherapy enters the healing equation from my perspective. And clinical hypnotherapy, just to be clear, is the therapeutic application of this tool or technique we call hypnosis. Clinical hypnotherapy is safe, it's evidence-based, and it is designed especially to allow us to access that part of the mind we call the subconscious mind. It is designed to help us uncover and resolve the root cause of trauma, to reframe the narrative that we have around it, address any limiting beliefs embedded in that difficult experience that we've been through. So essentially, it can help us reduce the emotional charge of any triggers. Ultimately, it can help us change the meaning, if you will, that we have intentionally or unintentionally assigned to our difficult event. In other words, to simplify, we address and release through clinical hypnotherapy the so-called baggage that comes hand in hand with trauma. It can be unhealthy patterns of anger and fear, low self-esteem, resentment, just to name a few, and many other patterns that no longer serve us. And we set ourselves free, in a way, to be who we really are, authentically. That is the goal. And if this is what you want, I'll invite you to use the link below this video to set up your free consultation, to find out how clinical hypnotherapy can help you address and resolve your trauma. You have so much to gain, and I hope to speak with you soon. Thank you for watching.